Good afternoon, everyone. This is Ryan Burke from the Pharmacy Technician Certification Board. Thank you so much for joining us this afternoon for an update about several important changes coming to our certification program for pharmacy technicians. Before we get started, I am going to turn things over to Nancy Allen for a brief welcome and introduction. Nancy, you should be unmuted now.
Thank you so much, Ryan. I want to welcome everyone to our webinar. We're pleased to co-host as the National Consortium for Health Science Education this opportunity with PTCB. We're pleased that the PTCB joined as a professional organization member for the consortium about a year ago. We know that through this relationship with PTCB, we'll be able to keep teachers, health science state leaders, those of you who have classrooms that deliver pharmacy technician curriculum will be able to keep you current with changes and what's going on with this organization. It really is one of our strategic priorities to provide professional development, meaningful professional development down to the classroom level. So we hope that you will enjoy and get lots of good information from Ryan. Ryan is a pharmacist, as you see there on the screen, and he has lots of experience. He serves as the Director of Professional Affairs at his organization. He's a liaison to state and national pharmacy associations, state boards of pharmacy, and pharmacy technician organization. He works closely with state legislation and also regulatory changes that affect pharmacy technician practice and monitors trends related to pharmacy technician education, training, and certification requirements. He's been with PTCB for about a year. He joined there August of 2017. Actually, that's 2 years. Sorry, Ryan, I didn't mean to short your experience there. He's worked at the American Pharmacists Association in practice and professional affairs and governmental roles. And he has experience with the PTCB certification through work at Walgreens. He earned his PharmD degree at the University of Louisiana in Monroe at the College of Pharmacy, and he also had postgraduate work at in Association Management and Leadership with the American Pharmacists Association Foundation. We just are looking forward to what he has to share. We also want to give a shout out to Pass Assured. They provide online pharmacy technician training programs. Some of you may use their program. They were instrumental in connecting and building this relationship that we have now with PTCB. So with no other introductions, I'll turn this over to Ryan, and we look forward to all he has to share.
Thank you very much, Nancy. And actually, I have been with PTCB for just over a year, so there may have been a typo in what we sent you, so I apologize for that. But I am really excited to share with you several important updates about our certification programs here at PTCB and share a little bit of background about what we do for those of you who may not be as familiar. We are also really pleased to now be part of the organization and get to work with Nancy and hopefully get to know many of you in the years ahead. So with that, I want to just provide a quick overview of what we're going to talk about today. I am going to share a little bit of background information about our organization. I'm going to talk a little bit about the education and training requirements that we are putting into place as part of the eligibility criteria for an individual to become a certified pharmacy technician. We're going to talk about what we call 3.0, which is our new technician certification exam blueprint. And then we'll also talk a little bit about the recertification process. And then something we're really excited about are certificate programs and an advanced credential that we're going to be bringing to the market here just next month. So by way of background, our mission is really focused on medication safety. And we do that through pharmacy technician certification. Anyone who has ever stepped foot into a pharmacy, it is very likely that you have interacted with pharmacy technicians. As a pharmacist myself, I know that they really are the backbone of the pharmacy, and they help us do our jobs and to do them as safely as possible. And then our vision is that we set the standard for certification that improves medication safety and patient care. And as I go through the slides this afternoon, I think you'll see that everything we do really is focused on that mission and vision. So where are we today in terms of numbers? Since we were created in 1995, we have granted more than 676,000 pharmacy technician certifications. And today we're really proud that we have more than 288,000 pharmacy technicians who are currently certified by PTCB. In any given year, we give about 50,000 pharmacy technician certification exams, and you can see there that last year we gave just over, or almost 49,000, I should say. These exams are delivered at Pearson VUE testing centers, and just a couple of years ago, we expanded the number of test centers from just a few hundred to over 1,400. So the exam is certainly very accessible to folks all throughout the country. We do administer the exam in all 50 states, DC, Guam, Puerto Rico, and not only do we administer it there, but the credential, the Certified Pharmacy Technician credential, is accepted in all of those states and jurisdictions. And then PTCB is included in the regulations of 45 states plus DC. We're not going to spend too much time today talking about the regulatory landscape, but one thing that makes pharmacy a little bit unique is that pharmacy practice and the requirements for an individual to become a pharmacy technician really vary greatly from state to state, not only in terms of what is required from an education and training perspective, but also what they're allowed to do and whether or not they have to earn certification to practice. In large part, what drives people to become certified pharmacy technicians is either that their state requires it, there are about 21 states that require it, or their employer requires it. So a number of large pharmacy chains, as well as hospitals and health systems, require technicians to earn certification in order to become employed or to maintain their employment with that organization. So according to the Bureau of Labor Statistics, there are about 417,000 pharmacy technicians that work here in the United States. And as you saw on the earlier slide, we have about 288,000 of them who maintain certification through us. I mentioned this earlier, but just in case anyone's unfamiliar, pharmacy technicians are the folks that are typically doing the prescription filling, they're measuring, they're mixing, they're counting, they're labeling, they're interacting with patients in the pharmacy, and they're also working really closely with the pharmacist. As I said, they really are the backbone of any pharmacy that you walk into. But there are also a lot of innovative roles for pharmacy technicians that have emerged over the years. Most people think of that more traditional role that you'd see in a community pharmacy, but there are also technicians working behind the scenes in community pharmacy, in health systems, and in other practice settings in some of these unique roles. So for example, some hospitals and health systems have technicians that specifically focus on billing and reimbursement for that pharmacy. In the community setting, you may have technicians that focus on community outreach programs. One of the more common specialized roles for pharmacy technicians is compounding. So if you think about IV medications or chemotherapy, a lot of times in hospitals and health systems, it's pharmacy technicians that are actually preparing those medications to be used in patients. Some of the other things that you might see more commonly in a community setting are things like point-of-care testing, so screening patients for blood pressure or high cholesterol, for example. Technicians are involved in assisting the pharmacist there. And then one of the newest roles that currently only 2 states allow is immunizations. So I think most folks at this point know that you can walk into a pharmacy and get an immunization, get your flu shot. We're actually just coming up on that time of year here. And so in Idaho and in Rhode Island, pharmacy technicians are actually now allowed to perform that task, and there are a number of other states that are looking at that as well. So here at PTCB, we are really excited about all of these emerging roles. We think it's really important to have these unique roles so that folks who enter into this career path as a pharmacy technician really see it as such, and they can sort of climb the career ladder, if you will, by fulfilling some of these unique and specialized roles depending on where they work. So shifting gears a little bit, I'm going to talk about what it takes to become a certified pharmacy technician through PTCB. Currently, our requirement for someone to be eligible to sit for the certification exam is that they have a high school diploma or equivalent, so a GED. Beginning in 2020, we are going to change those eligibility requirements. We have been talking about this change initially since 2013, and it's taken us many years to work with stakeholders, to gather data, to look at our job analysis, and to really understand what should be the eligibility requirements for pharmacy technicians. And so starting in January of 2020, there will be 2 eligibility pathways for someone interested in becoming a certified technician. The first of which is to complete a PTCB recognized education and training program. And in the subsequent slides, I'll talk a little bit about what it means to be a recognized program, and if you have a pharmacy technician training program at your institution, how you can go about becoming a recognized program. And then the second is equivalent work experience. And equivalent work experience at PTCB is defined as at least 500 hours. What's most important to understand, however, is that whether a technician chooses to go through an education and training program, or maybe they're not in a position to attend an education and training program and instead go through that work experience pathway, the knowledge required to be a certified pharmacy technician is the same. And I'll get into a little bit more detail here in just a couple minutes. So I mentioned becoming a recognized program. So for those of you on the phone who may have a pharmacy technician program at your institution, there is a really easy way to make sure that your program is recognized so that way any pharmacy technician students who go through your program will be eligible to sit for the certification exam starting in January of next year. So the way that this works is that a recognized program must include specific knowledge in their curriculum, and the knowledge really supplements the exam content outline. So as I mentioned, we've been at this since 2013, and as we've worked with subject matter experts and looked at data, what we learned is that there are certain aspects of required knowledge for pharmacy technicians that are best taught through didactic and experiential education, or perhaps through on-the-job training. So some of you may be familiar with accreditation. So there are 2 organizations that exist that accredit pharmacy technician training programs. One of those is a collaboration between the American Society of Health System Pharmacists and the Accreditation Council for Pharmacy Education. That's the first one you see here on the 3rd bullet, as well as the Accrediting Bureau for Health Education Schools, or ABHES. So any programs that are accredited by one of those 2 institutions are automatically recognized by PTCB for 2020, and no further action is required of those programs. However, if you are not an accredited program, not to worry. What you would do is you would submit to us an attestation that your curriculum includes all of the required knowledge that we have outlined for pharmacy technicians. And on just a few slides, I have an example of what we're talking about. I want to be really clear that this is different from accreditation. We are not accrediting programs. There is no cost to become a recognized program. You're simply attesting to us that your curriculum does include what we require to be taught to a pharmacy technician. So the types of programs that can be recognized, we have a lot of them. So certificate and degree programs, those that may be associated with pharmacy schools, those that are based within an employer. So for example, several large chain pharmacies as well as health systems have their own in-house training programs that they've built. High school programs are eligible to be recognized, as well as military training programs. So now to get into the details a little bit here, What you see on the screen is what we call the knowledge reference document. This is available on our website, and it is linked at the end of this slide deck here, so we can be sure that all of you receive a copy of it. But the way that you use this document is by looking at each of the three columns. So the column on the left, the blue column, is the content outline for the pharmacy technician certification exam. That is the content that a technician can be expected to be tested on when they go to sit for the exam. The second column, the required knowledge, is what we require you to teach as part of your pharmacy technician program curriculum. And unfortunately on this slide you don't see any bullets, but within the actual document there are a number of required knowledge areas. And so if you were to want to submit an attestation to us, the best thing for you to do would be to take this document and focus really on the first two columns, the blue column and the white column, and compare that to your curriculum to make sure that each of those knowledge areas is in fact covered in your curriculum. And then the gray one are recommended knowledge areas. So these are some of the things that might be specific to one practice setting over another. For example, something that might be more common in a hospital or health system would be sterile compounding, so making chemotherapy medications, for example. And so the recommended column is not something that is required to be taught, but it certainly would be beneficial to technicians as they think about some of those more unique or specialized roles that I mentioned earlier. So submitting the attestation is simple. You simply go to our website, attest.ptcb.org. You see on the left-hand side of the screen here what the attestation looks like. Really, you're just filling out contact information, very basic information, and then at the end of this is the attestation where you check the box saying, yes, my curriculum includes the required knowledge. You're also agreeing to be subject to an audit. So as part of our quality assurance process, we will be auditing a random number of, or excuse me, we'll be randomly auditing a certain percentage of recognized programs, and that will start later this year or into 2020. And so at any time, you should be prepared to submit to us program materials or lesson plans or other things that would demonstrate to us that you are in fact teaching what you've said you are teaching through this attestation process. Once your program is recognized, your program will appear on our recognized program list on our website. We're actually in the process of launching a new website next month, and so we'll have a much nicer, more interactive directory where we'll actually link to your program's website if that's something that you have available. But otherwise, you can see here on the right side of the screen kind of what it looks like right now. We show all the programs that are offered either nationally or in multiple states. And then as you scroll down through the page, you can see state by state. Again, when we launch the new website next month, this will be a much cleaner, easier to use directory, and folks will be able to link directly to your program's website as well. So now on to the pharmacy technician certification exam. We are currently on the second iteration of the exam. 3.0 is just our internal terminology for the blueprint that is coming in 2020. The way that we develop our exam is based on a very large job analysis of pharmacy technicians. It's important to keep in mind that our certification exam is meant to be reflective of pharmacy technician practice as it is today. So in 2016, we conducted a job analysis of more than 40,000 pharmacy technicians. That's how many technicians responded to the survey. And in that job analysis, what we're looking at is what are the tasks you most commonly perform as a pharmacy technician, and what are the consequences of not doing that task correctly. So going back to our mission around medication safety, what we're really measuring on the exam is a pharmacy technician's knowledge, skill, and ability to perform their jobs safely and to have those skills that are required of pharmacy technicians in entry-level practice. And so the new exam blueprint is based on that large job analysis completed in 2016. And it's really focused on key areas of pharmacy practice that are relevant across all practice settings. And so the four knowledge domains that will be on the exam in 2020 are medications, federal requirements, patient safety and quality assurance, and then order entry and processing. Within each of these 4 domains are much more specific knowledge statements. That was actually that blue column on the page I showed you earlier. But the link here is at the bottom of the slide, and we will, of course, make these slides available to you so you can get a much more in-depth look at what is covered on the exam itself. So I mentioned that the new exam blueprint will be much more relevant across practice settings. So this illustration just shows some of the things that are being removed from the exam, from the current version of the exam, and will no longer be on the exam in 2020. So for example, sterile compounding, as I mentioned earlier, is something that's really specific to the health system setting. So that will no longer be on the entry-level pharmacy technician certification exam. Likewise, billing and reimbursement is something that was really focused on the community pharmacy setting, and so that will no longer be part of the entry-level exam. As I'll mention in a few minutes, we do have more specialized credentials that are coming for some of these areas that have been removed from the entry-level exam. But for now, the key takeaway is that the pharmacy technician certification exam is applicable to every practice setting that a pharmacy technician may ever work in, and it really is designed to measure a pharmacy technician's knowledge, skills, and abilities at the entry level. So just a quick note about recertification. I know this is not as directly relevant to many of you on the call today, but this is good information to share with any pharmacy technician students that you may have. We have recently totally streamlined our recertification process. In the past, pharmacy technicians have had to manually enter all of their continuing education credits into their PTCB account. We now have an integration with something called CPE Monitor, which is a product of the National Association of Boards of Pharmacy that tracks continuing education activity not only for pharmacy technicians but also for pharmacists. And so now the recertification process is instantaneous because of that integration, and it makes it much simpler, not only on the technician, but it also allows us to process those recertification applications much more quickly. For anyone who's curious, our requirement is that pharmacy technicians recertify every 2 years by completing at least 20 hours of continuing education, and at least one of those hours has to be in patient safety or med safety, and the other one has to be in pharmacy law. So the last thing I'll talk about today are the new credentials that we are launching in just about a month from today. So as we have thought about how to help build that career ladder for pharmacy technicians, and as we've looked to various states that are starting to think about some of these more unique or advanced roles, such as administering immunizations, for example, we needed to find a way to help the profession have a way to ensure that pharmacy technicians who are performing some of these more advanced or specialized roles have the knowledge, skills, and abilities to do so. And so that is why we are creating several assessment-based certificate programs as well as an advanced designation for pharmacy technicians. So the first 5 certificate programs that we will launch are Technician Product Verification, Medication History, Hazardous Drug Management, Billing and Reimbursement, and Controlled Substance Diversion Prevention. We already have launched in late 2017 a certification program specific to sterile compounding. So for technicians who work in that health system world or in other settings where they may be preparing sterile products, we do have a specific certification program for them. These certificate programs will require that someone have that baseline credential, so they have the PTCB Certified Pharmacy Technician credential, and they'll have to complete some sort of education and training that is specific to each of these topic areas. In some cases, there will also be a work experience pathway for these individual certificate programs, but we do expect that many technicians will complete some sort of education and training program to prepare them for this very specialized assessment. All of this is building up to an advanced certified pharmacy technician credential. There are a number of states, including, for example, California and New Hampshire is another one, that are looking at this idea of having multiple levels of pharmacy technicians. And so as a way to help them differentiate between the knowledge and skills of different technicians, we're not only launching these certificate programs, we're also launching an advanced certified pharmacy technician certification. And so the eligibility criteria for this are that you again have that baseline CPhT credential. You successfully complete at least 4 of those certificate programs that I mentioned on the previous slide. The 5 programs that I mentioned on the slide are just the first 5. We have a much longer list of probably more than 15 of them that we intend to create in the coming years. And so a technician will really have a menu of options to choose from, depending on either what their employer requires or where they're trying to go in terms of climbing that career ladder. And then the final piece of the eligibility criteria is to have at least 3 years of work experience as a pharmacy technician within the last 8 years. And then going back to sort of the maintenance of certification or the recertification process, anyone who gets to the level of this advanced credential from PTCB will be required to complete additional continuing education hours on top of those 20 hours every 2 years in order to maintain that advanced certification. So with that, these are the links to some of the resources. Again, we will make these slides available to you, so don't worry about taking these down right now. And then before we get to questions, I want to make a quick mention that Tuesday, October 15th is International Pharmacy Technician Day. This has really become quite an event for us here at PTCB in recent years, and it's actually gotten picked up all over the country and around the world, which is something we're pretty excited about. As some of you may know, American Pharmacist Month is in October, and so October 15th is dedicated to celebrate, again, those individuals who are really the backbone of any pharmacy that you may walk into. And so we're really excited about that, and so we'd encourage you, if you interact with pharmacy technicians, either through your programs or to visit your own pharmacy, to just thank them next time you see them in October. So with that, I'd love to open it up for questions at this point, and I think the best way for us to do that would be for you to just type them into the chat, and we can address them one by one. So within the controls for the Zoom meeting, there should be the option for you to chat, and so if you'll just type it in there and make sure that it's set to go to everyone, I would be happy to respond to any questions that we have at this point. Going to give folks just a minute. Let's see. Yep, so first question is, will the PowerPoint be emailed to all participants? And the answer is yes. We will email a copy of the slides, and then we'll also, once the recording is available, we'll also make that available to everyone as well. So we have another question here. How do you feel this applies to current technicians with lots of experience already? So first and foremost, on the new eligibility criteria for the entry-level credential, if a technician already has their CPhT credential, that does not impact them at all. Those eligibility criteria are strictly for people who are new to the pharmacy technician world and trying to earn that certified pharmacy technician credential. So I want to be really clear that this does not impact currently certified technicians. On the advanced certified pharmacy technician front and on those certificate programs, we think this opens up a whole world of possibility. Sometimes we hear from individuals, employers in both the health system and community setting that are looking for ways to build a career ladder within their own institution, but they don't have a really objective way outside of maybe a job description to say that a particular individual has some specialized set of knowledge and skills. And so we think these new certificate programs will open up that opportunity for a pharmacy technician who maybe has been in practice for a while to earn some of these specific credentials and go to their employer and say, hey, look, I have these specific skills. Perhaps I can move into a more specialized or unique role within that setting. We certainly understand it will take time to get there, and that is especially true in the community setting. In the health system setting, it's much more common to see lots of diverse roles for technicians and a more well-defined career ladder. But I think slowly, as we've started to talk to some of the employers on the community or the retail side, there is a recognition that there is this need to have more advanced and specialized technicians. So we're excited about the possibilities that these new credentials may bring to the profession. All right, let's see. So next question is, can attending this webinar count for any CPhT CEs? Unfortunately, it cannot. This webinar was not accredited for continuing education. Certainly, that is something good for us to think about in the future, but unfortunately, this one was not set up for that. Is there specific wording available that defines work experience? Wondering about internships. Yeah, so great question, Courtney. So work experience can be either paid work experience, so someone working out in the field, in a pharmacy, earning a salary for that, or internship can also count as work experience. When we roll out the new application in January of 2020, there'll be a little bit more detail there. But if what you're getting at is, can internship hours count toward that work experience, the answer would be yes. However, one thing I would say is that if a pharmacy technician is going through a training program and the internship is part of that training program, then probably the best thing for them to do would be to select the completion of a recognized program as the route that they took to be eligible to sit for the exam. But the short answer is both paid work experience as well as internships can count toward the experience requirement. All right, next question. Do you feel this will start to eliminate opportunities for students to get jobs that start at entry level and don't yet have certificates? So I don't have any data specifically on this. My thought, just based on what we've talked to employers about and what we've seen from boards of pharmacy and other stakeholders, is that there's still plenty of demand for technicians who work at the entry level. And in fact, in some states, we have even heard about a shortage of pharmacy technicians and that employers are having a hard time finding qualified pharmacy technicians. So I don't think that there will be any elimination of technician jobs at the entry level or for technicians who possess that certified pharmacy technician credential. We do hope that these other credentials help to build upon that, and so technicians could move into more unique and specialized roles. As I said earlier and repeated a whole bunch of times, pharmacy technicians really have a critical function in any pharmacy that you work in, and I believe that we'll always need those technicians who are functioning as that true support staff and really working behind the scenes to keep the pharmacy running smoothly. All right, the next question, is it the intention specific to employers with technicians that are already employed to have further career opportunities? So if I understand the question correctly, yes, the goal is that this would open up opportunities not only within an organization where a technician is currently employed, but also perhaps outside of that organization as well. As again, part of what we do in the partnership development team here at PTCB is we talk to employers constantly, and I think without fail, the employers that we've talked to have been really excited about these credentials helping them to build a career ladder within their own organization. So I think, again, this will hopefully open up some opportunity. All right. Are all of the items listed in the outside circles on the Venn diagram going away? Yes, so the items listed outside of the circles on the Venn diagram will not be covered on the PTCE itself. However, in some cases, those may be required knowledge areas to be taught through an education and training program. So for details on that, I would refer you to the knowledge reference document, which is linked in this slide, in which we will send out following the conclusion of this webinar this afternoon. The next question is about practice exams. So yes, very soon we will be rolling out a new practice exam that mirrors the content outline for the version of the exam that will launch in January. So stay tuned. We'll have more information about that probably next month, I believe. But as soon as we launch our new website in October, there should be more information available about the newest practice exam that mirrors the requirements for the 3.0 blueprint. All right, we have another question here. Do you think the passing rate for high school students will increase with the new CPhT exam revamped in 2020? So I don't have a prediction, and I don't think anybody here at our organization does have a prediction about what will happen to the pass rate generally. So the last time that we revised the exam blueprint several years ago, there was a change in the overall average pass rate. It is likely that that would happen again with any new content outline or blueprint for an exam. You would expect that the average pass rate would change a little bit. But unfortunately, there isn't really a way for us to predict how that will go. I will say that one thing, just to kind of reiterate here, is that our goal is that the exam is applicable across all practice settings. And so an individual who passes the exam, that would indicate that they have the entry-level knowledge for any pharmacy practice setting. So I think it is a good question. I think we're all eager to see what happens to the average pass rate after we've had several months into 2020 and folks have sat for the new version of the exam. I will also note that we do publish pretty extensive information about our pass rate. So year after year, we publish the pass rates for the PTCE on our website. And so that would be a good place to check after we've had some time to have the new exam out there and folks sit for it. All right, let's see. We have another question. Would the new exam be labeled as easier or harder or just different? Just different would be the answer to that. Again, based on that 2016 job analysis, we really aimed to make it applicable to all practice settings at the entry level. I don't think any of the folks who develop our exam or any of the folks that are experts in measurement here would say the exam is getting easier or harder. It's just that the content is going to look a little bit different. And then will the new exam have the same number of questions? Yes, and that is true both for the number of questions that are scored as well as the number of questions that are unscored. So for those of you who are unfamiliar, there are 10 unscored questions on each exam, but the candidate is unable to distinguish scored questions from unscored questions. All right, and looks like we have another question. Do we know the current pass rate for the existing exam? Yes, so our pass rate for the exam is typically around 58% each year. It has been pretty consistent for the last handful of years. It's been 57%, 59%, 58%. So that is the national average for the exam. And I see I can point you, as part of the follow-up, I will send the link to where that information is located because it looks like someone may have had some trouble locating where the pass rates are listed on our website. So I will be sure to pass that along as part of the follow-up. All right, I don't see any questions quite yet, so I'll pause for just 30 seconds or so to see if anybody else thinks of some other last-minute questions. All right, not seeing any further questions. I again want to thank all of you for joining us this afternoon. This webinar was recorded, so we'll make the recording available. We'll also send a copy of the slides so that you have easy access to the links, and we'll also send the link to where on our website you can find the information about the pass rates, the current pass rates on the exam. And I again want to thank Nancy and her team for giving us the opportunity to present this information to you this afternoon. And with that, we will wrap up. I hope everyone has a great evening. Thank you.
Ryan?
Yes.
Hey, I just wanted to remind those on the call, if you're attending the 2019 National Health Science Conference in St. Louis in early November, that PTCB will be there in the exhibit space area. So you're welcome to visit with them there and continue the conversation. And many thanks from the consortium for you providing this content. We look forward to the email, and we'll post this recording on our website as well.
All right. Thanks a lot, Nancy. Bye, everyone.